Thank you, Dr. Tamina. It is the victory day, everybody. We are very happy to do our scientific program in this day. So I also remember all the Shohid who has dedicated their life in the independence of Bangladesh. Eco is intervention. As Anuruddha Das said, he has only one subset. And he said it is a very big problem and how to cover it. For me, I think it is the ocean. In intervention, if I consider the eco, it is a big chapter. So anyway, I want to just summarize it. What I consider: introduction, modalities of eco, rule of eco in ischemic heart disease, rule of eco in heart failure, rule of eco in cardiomyopathy, rule of eco in valvular heart disease, and rule of eco in congenital heart disease, and rule of eco and other condition, and conclusion. What that is, intervention is everywhere in the eco of the heart, making it imaging modality for choice immediately before and during after cardiac interventional procedure. It helps to guide selection and execution of intervention, even intervention, and enable every detection of the complications. If we have seen there are modalities of echocardiography, it may be 2D or 3D, transesophageal, it may be 2D or 3D, and intracardiac echocardiography. If we consider echocardiography in ischemic heart disease, it is already said our Honorable Speaker Anuruddha Dev, what importance for intervention. We have to consider it pre-procedural aspect, LV function assessment, assessment of the viability, assessment of the aortic root, presence of calcification. This should be assessed before intervention procedure, especially related to the coronary artery. During the procedure, to identify if there is a complication such as cardiac tamponade during the procedure. If we consider it post-procedural purpose, we will see the improvement of the regional and global function of the LV and identify any residual complications. We see LV global function as well as wall motion abnormality. Why regional coronary territories? If we identify part of the myocardium is involved, then we can do the necessary intervention accordingly. There is segmental, and it is already said by our previous speaker, and this is what is important to us for intervention cardiologists. This segmental distribution is related to the particular coronary arteries. What is also important, by seeing the wall motion abnormality, again, we can assess which territory and which vessel is involved in the ischemic heart disease. These are another important aspect. By the test among this test echocardiography by using dobutamine is very important. This also important for biopsy as well as the territory of the heart, and accordingly we can do coronary angiogram and subsequent intervention. Usually dobutamine stress echocardiography is the choice. In this, if it is dobutamine stress echo, that gets the ischemic status of the mind. These are the pictures of dobutamine stress echo. If I have to consider a case of 56 years, non-diabetic, normotensive smoker, having extensive anterior MI in the last December, that recently he has undergone echo and CG. What we have to see. This is the ECG of the particular patient. This is extensive anterior MI. If we see, there is a wall motion in the IBS as well as the apex. There is a wall motion abnormality. The same territory, there is wall motion abnormality, including mild mitral regurgitation. What we have seen in the coronary angiogram. This is the LED lesion, which corresponds that of the wall motion abnormalities of the echocardiography. Another 55 years old lady, diabetic, hypertensive, got admitted into the hospital with complaints of severe central chest pain. She was diagnosed as a case of inferior MI. In the echo, we got the inferior wall hypokinesia as well as involvement of the apical lesion. And in the coronary artery, we see he has a RCA lesion. So echo in coronary angiogram. This is very important. And at least we can get some idea of this. Strain imaging, this is another already said my previous picture, but in intervention, this can predict a coronary artery disease non-invisibly and also territory and severity of the coronary artery disease. And it also useful to see the prognosis of post-MI and post-PCI status. This is the strain. If we consider the echo in heart failure, it is already lecture given by our Professor Sabina Hashem. The heart rate echocardiography is the mainly two things we consider. One of the LV function, another is end-stage heart failure, where we have to consider the CRTD. In CRTD, there is a desynchrony. We can do echocardiography, and after putting the CRTD, this may be again go to the normal aspect. This is the important in the intervention. These are the desynchrony. If we have for cardiomyopathy, here also echo has an important role. In that, this is again related to the heart failure and related to the desynchrony. But in that, hypertrophic cardiomyopathy is very important. Usually after alcohol septal ablation, we can see the pre and post procedural effect. What is that? Before, in this picture on the left hand side, before the procedure and thinning of the wall. So, but you can see the effect of septal ablation is one of the important interventional procedure. Valvular, especially we have done the valvuloplasty as well as valve replacement. In we have seen by echocardiography. We assess pre-procedurally, identify the lesion, assessment of the severity, find out the etiology, and assessment of hemodynamic consequence, and assessment of suitability of the intervention. During procedure, is there complication during the procedure? What we have in the procedure, assessment of the and gradient, and residual complication of the procedures. If we consider the more or less same to evaluate severity of the mitral stenosis with fluoroscopy to guide mitral valvuloplasty, and exact fluoroscopy we can sometimes use. During procedure, immediate assessment of the results of valvuloplasty, that is visualization of the valve anatomy, determination of the transvalvular gradient, mitral valve area, detection of mitral regurgitation, allows early detection of complications. In this case, we also see the echocardiography in relation to the mitral stenosis intervention, more accurate stenosis, and in particular mitral valve area using multiplanar construction from 3D data set to ensure the eccentric mitral valve orifice. These are slides before and after PTMC. The same, there is a reduction of the pressure gradient. In echo, important role in the mitral valve repair. Mitral clip is a catheter-based approach to deliver a clip placed in the mitral valve leaflet tips, especially creating an H2S repair. Mandates case selection using combination of TE and TTE. We have to see the etiology, severity of the mitral regurgitation, and suitability for the percutaneous clipping procedure. But these are which can be detected by echocardiography, and we also exclude the cases for this purpose. These are some pictures related to the mitral clip. In replacement, that is echo plays a very important pre-procedure, during procedure, and after procedure. I think there is a lecture after me on this one, so I like to escape it. But this also another lesion. What in by echocardiogram here? Again, pre-procedurally we assess the severity, and pressure gradient, and we have to evaluate the subsequent results. These are the pulmonary stenosis before procedure, and after procedure, also pressure gradient. They are through the and after procedure, what we have seen, there is a reduction of the pressure gradient. In congenital heart disease, especially it is very important pre-procedure as well as during procedure and after procedure. Both the motor echocardiography, 2D and TE, both are used. What we have seen there, again, if we consider the ASD, before procedure, we have to evaluate anatomy of the lesion, size of the lesion, hymns and hemodynamics, during procedure, placement of the occluder device, and assessment of successful closure. And if there is any residual shunt, we can easily apply echocardiography. In this case, especially before procedure, we have to see that rim is adequate, is not the closure. 1 minute আছে নাকি? Huh?
Sir, 1 minute left.
1 minute. That's okay. These are the occluder. This is the other occluder. In the ventricular septal defect, at present only muscular BSD and perimembranous BSD is closed percutaneously. Successful percutaneous closure of post-myocardial infarction ventricular defect has been also reported. What in T is essential to evaluate anatomy, size of the BSD, procedure, and very helpful during after procedure. During the procedure, we see the proper placement of the device and your assessment of successful closure, and if there are any residual shunt or any complications. These are the muscular BSD. These are the procedure of closure. In addition to this, echo is also very important in the calculation in pericardiosynthesis. Echocardiography is oftenly used to guide pericardial synthesis in addition to the fluoroscopy and may reduce the procedure-related complication. TTE determine the size and location of the pericardial effusion. Factors important in deciding the site of approach and of needle trajectory. Other situation, there is also use of echo, especially in the appendage closure. This also plays an important role. In conclusion, what I want to say, rapid evaluation in intervention cardiology demands details and accurate imaging of the cardiac structure. The evidence of echocardiography is almost every stage of all procedure in cardiac laboratories is inevitable, suggesting an important step of echocardiographer. So echocardiography plays a pivotal role in successful intervention and its outcome. Thank you.